Our group is 223 staff total in the Environmental Services Department alone. So they are working in every facet. They're patient-facing, so they're working in the rooms, sterilizing, sanitizing around the clock, the OR departments, you know, the patients' rooms, the hallways, anywhere you can think of where human beings are interacting, engaging. So they're a huge piece, a very big piece of this hospital. Some of our employees will come in from time to time asking about various things. I have more recently had somebody who was going through a domestic issue and had to leave their home abruptly. Also someone else who was going through a bad issue at home who was then homeless, and they were looking for resources. So that's where I pulled Kristen's name out and Working Bridges and said, have you contacted them yet?
Hi, I'm Kristen Caney, and I am one of the Senior Resource Coordinators with the Working Bridges program of United Way of Northwest Vermont. People, when they come to me, can be in a very vulnerable state, and I feel so honored to be able to help them access community resources, whatever is best for them. Housing stress, financial stress, childcare stress, elder care stress, food insecurity, the list goes on and on.
The Employee and Family Assistance Program really utilizes the internal resources for our employees, you know, benefits, workers' comp, disability, but the external resources that get brought in by the Working Bridges Resource Coordinator and just the United Way generally really add to the robust work with life-work balance for many of our employees. Because as we know, you know, the mental health issues often have roots in financial insecurity, food insecurity, housing insecurity, and those are the things that really complicate productivity and retention.
I started working with Amy when she became the administrative assistant for the Environmental Services Department. The stressors she was dealing with on a daily basis, like many of us, she is in that sandwich position of taking care of her child, herself, and her parents.
So Kristen's been very helpful in providing me some information, some resources for that. There is some comfort in knowing, though, that you're not alone. And that's the biggest piece. That's been like my saving grace.
She has done a lot of research herself with her own journey, but she may not be up on the latest, which our Working Bridges team is up on, because on a daily basis, state resources and federal resources change.
As a single mom to a child that eventually, at 33, in the middle of his life, he was interrupted by a brain injury. I had to navigate the system, and people that get suddenly injured don't come in instruction books. Like, you know, no one hands you this big book and says, oh, hey, by the way, this is what you do. This is where you go. This is how you handle it, you know? So I really do think, just to add to Working Bridges, that it's nice to have somebody who says, okay, we have the resources.